Hello everyone, and welcome to my amateur video on McDonald cerclage placement. What I have here laid out are the instruments that we are going to use. I'll show you the task trainer in a moment. As I said previously in my discussion post, in a real cerclage surgical situation, we would have additional retractors. They're absolutely necessary simply to gain exposure to the cervix. But for simulation purposes, they're not necessary. And also, I could only steal so many supplies from labor and delivery, and I could not take the retractors. What we have here, though, that we are going to use are two ring forceps. We have a needle driver, a hemostat, pickups, and then typically we would have suture scissors. These are actually curved Mayos because that's what I was able to find today. Over here we have our two suture options, and I'm going to demonstrate both. On the top here is what I typically use for a cerclage, and that is a 5mm Merceline tape. It literally is 5mm, so it's much thicker, and I will show you that when we get to that portion of the video. Because it's so thick, once you tie it, you have the two arms, like the ends of the suture, and I tie those together with this silk suture. The alternative for suture is this, which is a number 5 Ethibond. It is same color as these towels, and I'll show you that in a moment. I'm going to demonstrate with that as well. This is much more flexible, less thick than the Merceline, and when we use this, we don't need anything to tag the arms together. When you look at data, evidence, and recommendations and guidelines, there is no clear benefit or preference for one suture over the other. This is the initial task trainer that we are going to use. It is actually designed for postpartum hemorrhage and not for doing any procedures on the cervix. This is the uterus, and it's hollow, so you can practice certain procedures necessary for postpartum hemorrhage with it. These are the channels that you can put fake blood in. And then this is the cervix. And what I like about this model is that it looks relatively realistic. I also like that we have this here, which I'm going to use as demonstrating the junction between the, we could say rugated, so it looks kind of, I don't know, irregular vaginal mucosa. The bladder would be under that, bladder would be under here, and thus we can't place our suture too close to this bladder reflection. On the posterior side, the rectum would be back here, so we cannot place our suture too high there either. Now, the thing that is not realistic about this model, and the big limitation, I think, of this task trainer, is that the cervix was not designed to do anything to the cervix, certainly not to drive a suture through, and consequently it is very difficult. There's a lot of resistance. It's a lot more difficult than in a real cervix to drive the needle and the suture through. So what I'm going to do, though, is I'm first going to demonstrate on this model using the thinner Ethibond because it's a little easier than the Merceline to drive through the tissue. Then I'm going to switch to a homemade low fidelity model of the cervix to demonstrate the procedure with the thicker Merceline because it lets me drive the suture through the simulated tissue a little bit better. Okay, so welcome to the first demonstration. As I said previously, this is our more realistic looking but probably less functional task trainer to mimic the cervix. I am going to demonstrate a McDonald cerclage with the Ethibond suture, which is thinner and more flexible, easier to drive through the tissue. So I am taking my needle driver, and because I need to take relatively large bites in comparison to the size of the needle, I'm going to load it a little higher on the needle than I typically would, at an angle like this, okay? I am going to take a ring forceps, and I am gently going to place it about 12 o'clock on the cervix. And remember, the patient has anesthesia at this point. And being careful not to twist or turn to potentially overly manipulate the cervical tissue, which in theory could lead to release of prostaglandins, preterm labor. I'm going to make sure and hold it very gently. And I'm also going to put a ring forceps posteriorly at about 6 o'clock. Okay, And then again, I'm making an effort to just hold them steady, not to twist them in any way. I am taking my suture here, and if we are saying this is the bladder reflection, namely above here, bladder is underneath, then I want to go just distal to that, around a little bit lateral to 12 o'clock. So I'm going to go in here, drive it through the tissue, and I don't want to come out quite there. So I'm going to come out here. And I'm purposely, sorry, you can hear my dogs running around, purposely avoiding directly 9 o'clock because that's where the blood vessels are. Then I'm taking this, and it's a little harder to pull through than it would be in real life. Okay, I'm going to put this down for a moment. I'm going to take my hemostat and tag that end, and then I would hand this in real life to my assistant who would be holding the retractor anteriorly. Then the second and third bites are ergodynamically, I guess I would say, the hardest because of limited exposure since we're doing this intravaginally. So what I'm going to do is, you can't see this, but I'm turning my body and backhanding. And I'm going to go in just under where those vessels are at 9 o'clock. And again, you can't see, but I'm twisting my body a little bit so I can see where I'm coming out posteriorly. I'm as high as I can without getting into rectum, which is up here. And I'm pulling this through, okay? Then I'm reloading, and I'm also going to backhand this next bite. And so I'm putting it in a few millimeters away from where I just came out and driving to just underneath 3 o'clock. Remember, the vessels come in at 3, so I don't want to hit those. Okay, so then I am continuing to pull it through. And I am twisting here just so you can see. I wouldn't do this in real life. And I want to go in here just above 3 o'clock. And then I want to come out maybe half a centimeter from where I went in. And I'm as high as I can get without being in the bladder, which is what you want. Okay, so I'm pulling this through. Now what I'm going to do is take my suture scissors and I'm going to trim this end. I'm going to take the hemostat off. And I am going to pull up on both ends to make sure there's no laxity in here. And then I am going to tie. And I'm doing a surgeon's knot, meaning 2 times through. That helps secure it. I'm tying it down as tightly as I can. And because this isn't meant to be a task trainer that one does cerclage on, the cervix is not going to actually come together in real life if it were dilated as it is here. When I cinch this down, the cervix closes. All right, so that's 1 throw. I'm going to do 2, 3, 4, 5, 6, 7. So a total of 8 throws because I want to make sure that doesn't unravel. Then I'm going to put a false knot in, which makes it easier to find when we go to take it out. So see how I'm leaving that loop on purpose. And I'm just going to put 4 throws in here because this is not for strength. Okay, so I've got that. So when I go to take it out, I'm going to be able to find it, and I'm just going to, I would use different instruments, but I'm going to pull up, slide my, I'd have long-handled curved Mayos, but slide under here and cut. As it is, though, this is a little bit too long. I don't want to leave this much length that the patient will see. So I'm going to take my suture scissors and just cut here. And that is it. Just to show you up a little bit closer, what we have here then is, here is where I started and went in. Then took a bite from here to here and back in there, and then posteriorly that 3 o'clock like that, and then I tied here. And we've got, again, just to show you up close, We've got the 8 throws down there on the bottom, false knot, and then 4 throws on the top. Okay, I'm now going to demonstrate on this obviously very low fidelity homemade model how to do the exact same procedure, so very simple, cervical cerclage, McDonald cerclage, but with the other type of suture. So this model is simply a water bottle, obviously, and then this is a bun maker. It's for making hair buns that is, I don't know, $1. You can buy it at any beauty supply store. It's spongy, so it allows me to drive the thicker Merceline through. So the Merceline looks like this in the package. It is a 5mm tape. It's on a similar size needle as the Ethibond. So you can see how that's thicker. Because it's thick, what we do in real life is lube it up with some gel. Okay, I already have my ring forceps on here at 12 and 6 o'clock, as I did in the other case, and that's just to use for traction. I have needle here and my needle driver, and I'm going to load the needle. I'm going to load a little higher than I would if I were suturing for other purposes, because I need to take big bites with relation to the size of the needle. So I'm holding my ring forceps to use for traction. We're saying this here is the junction between the cervical, the cervix, and the vagina where the bladder would be behind. So the water bottle is the bladder. So I'm taking my first bite in about 12 o'clock and then out a little above 3 o'clock. Remember to avoid those vessels. Okay, and then I'm going to take my hemostat, tag that end, and I would be giving it to my assistant who's holding the anterior retractor, but since we don't have an assistant, I'm just going to place it up here. I've reloaded the needle. And I am going to backhand this bite from 3 to 6 o'clock, and you can't see, but I've turned my body to be able to reach. So I just drive it through. And exposure when you're doing vaginal surgery can be difficult, so sometimes you have to contort yourself. So I'm pulling that through. I'm reloading the needle. And this bite from 6 to 9 o'clock, I'm going to backhand again, and I'm twisting my body to the other side so that it allows me to drive the needle the way I want. I'm taking a bite just under 9 o'clock, because remember the vessels come out at 3 and 9 o'clock. Regrasping my needle, okay, and I'm going to reload it. And then this last bite is easy. That's just from 9 o'clock to 12 o'clock. And I'm leaving some space between where I started and where I'm coming out here. Okay, so I've now got my cerclage placed, okay? So I'm going to cut this needle off. Okay, and then I've got my 2 arms that I'm gonna really try to pull up on. Get rid of any laxity there, because I want the cervix to close well. Just because this model, the cervix is bigger than a real cervix, I don't have quite as much suture to work with to tie. I usually use 2 hemostats to tie for this, but I could only find 1 today on Labor and Delivery that I could steal. So pulling up, okay? And then I'm gonna try to take 6 throws. You don't have to do a surgeon's knot with this Merceline because it's so thick that it ties down tightly. So I'm really pulling as hard as I can, honestly. And then I'm gonna try to get 5 additional throws in, which I think I'm gonna be able to do. 2, 3, 4, 5, and didn't leave myself enough to work with. Okay, so we got 6 there. Okay, so I'm now going to use this hemostat to tag, or to keep those two ends together, because I'm going to tag them together with a silk suture. I'm going to load that needle. That's a much smaller needle here. And I'm going to take my pickups, and actually I'm going to take this hemostat off. So I'm going to take my pickups, and I'm just doing a figure of 8. I'm really just trying to tag these two arms together, so when I go to take the cerclage out, I can find it easily, more easily. Okay. And this is not for strength, so all I'm going to do here is 4 throws. And then I'm going to trim the ends here, and I want to trim this also because I don't want the patient to see or feel this, so I need to trim it shorter. So I'm going to trim it about like that. Do the finished product a little bit more up close. There's that thicker Merceline I told you about. So this is our knot, our 6 throws, and then we've just tagged the ends together with the silk suture so we can find it when we go to take it out. If this, we're saying that's our bladder, so we're up good. I'm happy with this. It's as high as it can be without being in the bladder. And you can see as it goes around there. So that's our cerclage, very simple procedure.